Why did I learn on TikTok that I've been shoving toxins into my vagina every month? I knew that the gender bias and medical treatment in the United States was bad, but this is ridiculous. I used to get frustrated that our tampons weren't covered by insurance or that we were still paying sales tax for it when you don't have to do that for other things like Viagra. While tampons and pads are kind of a necessity. But now I learned that not only that, but there is arsenic, lead, and other metals inside of me 1 week every month since I was 11 years old. What the fuck? Let's talk about it, because this is not the first time that women have been screwed over by the medical system in America. Women have always been secondhand citizens in the medical industry, whether it's this toxic tampons, the lack of access to healthcare like abortion, or just complete lack of medical research on women's bodies, instead focusing on men's bodies. These issues do affect everyday women's healths. These toxins that are inside of me, the autism diagnosis that was missed till much later in my life, they didn't even start testing medication on women until 1993. That absolutely will make an impact on our health and wellness as women, as well as our reaction to different medications and treatments that are coming out. We really just started learning about the female body recently. You can tell by how many men can't find the clitoris. First, let me introduce myself. I'm Hazel the Heretic. I have a lot of opinions while constantly using humor to cope through all this madness. So please subscribe to the channel if you want to go on this journey with me, like the video if you like it, and comment below your thoughts about this insane medical news. Or do you think it's just TikTok drama? I read the original paper, so you didn't have to, from UC Berkeley, College of Public Health, Tampons as a source of exposure to metalloids, which was apparently made available online all the way back on June 22nd. Well, I didn't hear about it till July 9th on TikTok, which is a little bit late for something that I would say is pretty big news. I learned about it from these TikToks from Viant05 and Ashwee Carter. Now, I did go through and summarize this original paper. I want to say that I am not an expert. I did get my undergrad in Bachelor's of Science in Kinesiology, so I got to use it for something. But I am not an expert in this in any way, and this is just to the best of my knowledge. But I'm going to go through the different sections of the paper so that we can have a good understanding of what it's actually saying and then my opinion about it as well. So if we look at the introduction, they talk about how there are no previous studies found by these researchers on this topic, which is crazy. Even though 52 to 86% of people who menstruate use tampons, either rayon or cotton. It is crazy that this is the first one being done when Tampax has had its patent since the 1930s. We're like 100 years too late to be having these tests, in my opinion. Another thing they said is that they were concerned about how the vagina can absorb chemicals quickly. They did say that there needs to be more research on this. They're worried about these chemicals getting into the bloodstream without being filtered by the liver, which can happen when chemicals are absorbed through the vagina, which can mean that these harmful metals in tampons could enter the body and potentially cause long-term health problems. Kind of an important thing to figure out. And yes, we need to do another study on how the vagina is able to absorb that. But from what we know about the vagina, this is a pretty big deal, in my opinion. They also discovered that these metals came from plants used to make tampons because these plants can absorb metals from the soil and the air. That's where they think these metals are coming from. It's coming from the manufacturing and agricultural process, and there might be other ways that it's coming around as well, but that is their main theory for how it's getting there. Now, if we go to the materials and methods section, in this experiment, they evaluated the concentrations of 16 different metalloids in 30 tampons from 14 different tampon brands and 18 product lines, which they categorized and compared by different tampon characteristics. So they looked at things like the region of purchase, so whether it was in the US, European Union, or the United Kingdom. They looked at the organic material, whether it was organic or inorganic, the brand type, as well as if it had a plastic applicator or not. Then, to test them, what they did was they cut small pieces from each tampon, including the inner core and the outer covering. And they used special machines to see if they had any metals within the tampon. Now, you can tell that they knew this article would get scrutinized because they tested each tampon twice. They picked tampons that were popular and sold well online, as well as store brand tampons from big chain stores. They made sure to include tampons with different levels of absorbency so that they could see how that would affect the testing as well. They found metals in every single tampon that they tested. That is insane. Every single one. What metals were in the different tampon, their concentrations, those varied from tampon to tampon. However, it is interesting that they were able to find something in all of the tampons. Now, the results section, they talk about how they analyzed these 60 samples from 30 different tampons to measure the concentrations of 16 metals. And here's what they found. There is a low variability. For most metals, the difference within a single tampon was small, with a 12.9% to 36.5% variation, meaning that their results were consistent. The variation between different tampons was a little bit higher, but it shows a good consistency over the results that they were getting. Now, they did have a high variability for mercury. When we looked at mercury, it had a higher variation within a single tampon, which was 63.3%, and a very low consistency between tampons with an ICC of 0.03. So most samples had mercury levels below the detection limit. So this is one that would maybe be a little bit uncertain. All 16 metals were detectable in the tampons. For 12 metals, 100% of the samples had concentrations above the detectable limit. The only ones that didn't apply to were mercury, chromium, arsenic, and saline, where only some samples had detectable levels. Also, they found that zinc and calcium had the highest concentrations, while arsenic had the lowest. Lead was one of the toxic materials found in all samples, which is not good. I think that is one of the biggest takeaways for me looking at this paper is that there is lead in every single sample they looked at. They looked at 30 different tampons, did 2 of each of them with 60 samples, and found some lead, which is a toxic metal that can easily be absorbed into the bloodstream in a place where your body easily absorbs things in. And I know that the levels are very low, but any level of that is concerning, in my opinion. The scientists also observed the differences in metal concentrations based on several of those factors that they were categorizing earlier. When they looked at organic versus non-organic tampons, they found that the organic tampons had lower concentrations of metals like lead and zinc, but higher levels of arsenic. The region that these tampons were bought also made a difference. Ones that were bought in the EU and the UK had lower levels of cadmium and lead compared to those bought in the US. Now, the applicator type they found played no significant difference in the metal concentration between the tampons with plastic applicators and those with no applicator or a cardboard applicator. So it doesn't seem like that is making a difference. Another thing they found was the difference between store brand and name brand tampons. Store brand tampons had higher levels of copper, nickel, and saline, but lower levels of zinc compared to name brand tampons. They also looked at the consistency of metal concentrations within the same brand and product line across different absorbencies and lot numbers. And generally, they found that the metal levels were similar within these groups. Now, the concentration of metals in the tampons varied widely. Here's a general summary. We found the highest concentrations were zinc and cadmium. The lowest concentrations were arsenic. Notable toxic materials were arsenic, cadmium, chromium, lead, and vanadium, with lead having the highest concentrations among these notable toxic materials. Now, if we look at the next section, the discussion, we see that they talk about their main finding. Overall, they found that there is a presence of metal. They found 16 different metals in various tampons, including some toxic ones like lead, cadmium, and arsenic. High amounts of calcium and zinc were also found. Now, they also found that there are variations in these metals, with different tampon brands and types, but there was consistency within individual tampons. There is also a difference by type, looking at organic versus non-organic, like we did before, or where they were bought. They also talk about their concerns about lead and the health risks that might lead to. They talk about how lead is dangerous, even in small amounts, and can cause numerous health problems, such as neurological, kidney, and cardiovascular issues. Kind of like really important systems that we keep working. It can stay in the body for decades, which is really interesting to think about, because if you are putting that inside of you every month for the rest of your life, and that can just build up, I wonder if that could cause problems as well. Just throwing out my own hypotheses or ideas. That's horrific. We also know that the neurological impacts at even low levels of lead exposure can affect brain functions like memory and learning. We have made a lot of rules over the past several decades that have limited lead exposure for people. We've realized how bad it is. So even in small amounts, in a place where it is very absorbent and constantly there, it seems important to me that there not be lead there. It seems like it's, I feel like that statement sounds stupid. Like I feel like that everyone should know that. But I understand that they are small amounts. However, with the high absorbency rate of the vagina in mind, I would absolutely not want lead to be there that long, in my opinion. Now, they also found other toxic metals like arsenic, which is known to cause cancer and other health issues like heart disease and skin problems, and also cadmium, which can damage kidneys and is linked to heart disease. They've looked at the different possibilities of sources for these metals. They talked about how the raw material might be causing some of the contamination during farming or processing. And they also talked about the possibility of intentional additions. Metals like cadmium, zinc, and others might be added to tampons for antimicrobial properties, odor control, or as lubricants. Which is interesting because I have very sensitive skin and I have always known never to go near odor-controlled feminine products because it can cause a lot of issues and mess with the pH of that area. So it's generally not recommended, I think, for most people, from my knowledge, which is not a professional, but just from what I know. So it would be interesting to see if there is any difference in the tampons for antimicrobial properties versus the ones that are doing it for odor control. Just an interesting thought. They also talked again about the difference between the organic and the non-organic tampon and how organic is 100% cotton, which might explain some of that metal levels. And the non-organic tampons are made of materials like rayon or a mixture of cotton and rayon. And that is why it might be having the metals that it does, is the different processes they both go through. Another thing that they discuss is the lack of testing. In the US, the EU, and the UK, there are few regulations requiring tampons to be tested for metals or other harmful chemicals. Now, this raises huge safety concerns. Since tampons are in contact with vaginal tissue, which might absorb metals more easily than skin, we don't know, and we need to do research on that. And it's ridiculous that we haven't already done research on that. There could be higher risks even at low metal levels, which I tend to personally agree with. They talk about how future research is needed, how it's important to study if and how the metals from the tampons can enter the body through the vaginal absorption, how that process would work, and what that would mean for the body, as well as the health risks. So more research is also needed to understand the health risks associated with this metal exposure from tampons. They also talk about the limitations of the study. They say that the sample size, there was a limited number of tampons that were tested, making it hard to draw broad conclusions about all tampons. Now, there was only 30 different types of tampons, 2 tampons of each type, therefore 60 completely tested, and we need to do more, but this is a really important first step, in my opinion. The multiple tests that they did can have an increased chance of a false positive, but the main finding that all tampons contain metal is clear. Even though there might be some issues, that is a clear finding that there was metal in every tampon. The study also doesn't provide information about how easily metals can leach from tampons into the body, which is really what we need to be looking at in future research, as well as the health risks and what that poses towards women. Now, as a conclusion, they say that this study is one of the first to assess metals in tampons, finding various metals, including toxic ones. They talk about how there needs to be better regulation and more research to understand the potential health impacts of these metals on tampon users. This is an amazing step one, in my opinion. It is ridiculous that we are still on step one, but I am very happy that someone has finally taken the first step. People that menstruate need to know that they can do it safely and that the products that we have available to us are safe and well researched. And in my opinion, they're clearly not. So I am currently free bleeding. There's no way I would put one of those in me right now, in my opinion. Now, I found this person on TikTok when I was going through and looking at all this information who made their own washable pads, and I loved that idea. So I'm gonna play their video clip real fast. I'll link them below as well. And I know that some other people are using Diva cups, so please let me know if you have any good ideas about what's worked for you below in the comments. I need as many suggestions as possible, and I think it'd be great if we could all help each other find some good, non-toxic ways to take care of ourselves while we menstruate. Women have been experiencing this discrimination for a long time, and it is only now starting to come to light since we're only now starting to test things on women. It honestly feels like medical neglect that we're just finding these things out now, when Tampax has been making them since their patents in the 1930s and making us spend so much of our money on them every single month. Only 100 years too late to let me know that there are potentially toxic metals in my tampons. Thanks a lot, man. That sucks. Now, I went and I created a timeline of women in the US and how we've had to fight tooth and nail to get some attention in the medical field. And I just wanted to lay it all out there. I'm sure that I missed some of the great events that a lot of people did. So please put them in the comments below if you can think of anything else that I should be adding to this timeline. But I'm just going to go over generally how women have been treated in clinical trials in the US. The first thing that really happened that really pushed the fact that women weren't in clinical trials to the forefront is the Thalmoid tragedy. Now, the Thalmoid tragedy was in 1962. It was in Europe, and it led the U.S. Congress to pass the Pfeiffer-Harris Agreement, which strengthened the FDA's authority and mandated changes to the drug development. Now, thyroid was used in 46 countries by women who were pregnant or who later got pregnant, and resulted in the biggest anthropologic medical disaster ever, with more than 10,000 children born with a range of severe birth deformities and thousands of miscarriages. It was introduced as a sedative and medicine for morning sickness without having been tested on pregnant women. Women began organizing over the discrimination in healthcare and biomedicine and clinical research in general, which laid the groundwork for the women's health movement. They started to finally kind of see that women should be involved in clinical research, but as you see, it's not quite that straightforward, unfortunately. The next big event was in 1973, when Roe v. Wade was decided, where we legalized abortion in the US and advanced women's reproductive rights. The next thing that came up, though, was in 1977, where the FDA created a guideline that actually excluded women of reproductive potential from phase 1 and 2 clinical trials, except for those with life-threatening conditions. So if you were already dying, you could do it. But otherwise, they didn't want to test women. This policy is broadly applied, essentially excluding most women from medical research. We take one step forward, we take one step back. It is a rough time. The next big event was in 1986, where NIH Advisory Committee recommended that women be included in studies and that clear rationale must be provided if they're not. But didn't actually do anything. So they recommended, oh, hey, maybe we should let women be in these studies now. But what that actually accomplished, unfortunately, was not anything. In 1993, though, the FDA finally reverses its 1977 guideline, mandating the inclusion of women in clinical research unless justified otherwise. So they finally turned around their very bad decision from 1977 in 1993. In the year 2000, FDA regulation also updated and allowed the FDA to place a clinical trial on hold if a sponsor excluded participants solely due to reproductive potential, even for life-threatening conditions, saying that the FDA could tell a new drug that they cannot go to market if they're not also testing on women. However, we talk about those couple steps forward, a couple steps back. However, in 2022, there was a Harvard study that found that women still remain incredibly unrepresented in clinical trials from leading diseases as of 2019. There was also an MRCT Center report which highlights significant underrepresentation of women of color in clinical trials and lack of data reporting on the intersectionality of biological sex and race, showing that women of color were getting the worst treatment out of this, which is unfortunately not surprising. Women of color were the least represented in these clinical trials. In 2022, that same year, Roe v. Wade was also overturned. It felt like the biggest step backwards I could ever imagine, and honestly, horrific. In 2024, we found out there are toxins in the tampons that we're putting inside of us for a week every month. First study done to test this. This is ridiculous. Now, if we look at recent developments, there was a Kaiser Family Foundation study that found that 29% of women reported having their concerns dismissed by doctors, and 38% had some negative experience with healthcare professionals. Honestly, that sounds low to me. I don't personally know, but most of the women in my life have felt dismissed by doctors at a certain point. Please put your own experiences in the comments below. I know some people that are amazing doctors and did a great job and really cared for me, but then I also have had ones that completely dismissed me. The current gender representation within the hospital workforce is also interesting because women make up 75% of the hospital workforce, but only 15% of CEO positions. There are some things that are being put in process right now to hopefully improve these things, like the FDA draft guidance, which aims to increase the enrollment of underrepresented race and ethnic participants in clinical trials, and the All of Us research program, which is an initiative striving to improve inclusivity in research. Now, these sound great. I hope that they continue to move forward and actually represent women well, especially women of color. I am just kind of at the place where I will believe it when I see it, but I hope I see it. As we look at all of this history, we see that women have been excluded from medical research for quite a long time, with 1993 being when the FDA finally let women of reproductive potential do phase 1 and 2 of clinical trials, which in my opinion is ridiculous. While medical research has historically centered men's bodies, which impacts our current day health and wellness, I have seen countless women talking about their stories of not being believed by doctors when they were seen, about how they had to worry about if they put on too much makeup, they're going to think they're okay, they're not actually sick, and then they won't get the help, medicines they need. But if they don't put any makeup on, then they won't be respected. It's unfortunate, and I've seen a lot of different people talking about their experiences. So please put them in the comments below if you have those as well. It's something that, in my opinion, needs to be taken more seriously, because it's really hard to feel safe as a woman in the US medical industry. You have to push to advocate for yourself every single time that you go into a doctor's office. And sometimes it can still feel as though you're a second-class citizen from my experiences. Also, this system denies our basic healthcare and bodily autonomies. That really, really sucks as well. Like, abortion is now banned in 15 states, impacting over 25 million women, not allowing them to get the necessary health care to potentially save their lives. with a maternal death rate 62% higher in abortion-restricted states, based on this CNN report and a study done by Boston University and the Commonwealth Fund. Now, I want to make it clear that people of color have had it the worst from the medical system. The medical system literally was hurting Black people by experimenting on them and lying to them. And Black women still today have a significantly higher maternal mortality rate compared to their white counterparts. It's important to remember that their healthcare has been impacted the most, and we need to fight to ensure that they receive proper healthcare, as this system sucks. As a woman, this system sucks. If I was a woman of color, it would be even worse, and I'm so sorry for you guys. It needs to be better. There's a lot of bias against people of color, women, people with disabilities, fat people, queer people, and I'm sure many more. It's kind of just a microcosm of society, and it shows how we've improved in some areas, but we still have so far to go for people to get basic health care, which, in my opinion, should be a right. Have you experienced any of these issues with the medical industry? Please put them in the comments below. I would love to hear more. When I told my mom that I had autism, she was initially a little surprised, but the next time we talked on the phone, she had like 5 different stories that were clearly me like having an autistic meltdown or showing another symptom. It was just not something that she would have ever looked at for me, and that my doctors never considered for me, even though I did go to many doctors for what are, in my opinion, autistic symptoms. Now, as an adult, I'm not officially diagnosed, partly as a little bit of a fear that I'll be discriminated against more if it's on paper, and it's hard to get an appointment. I know that sounds dumb, but it's kind of true. This system was just not made for people that need help. You have to put so much emotional and social energy into just making an appointment to just deal with the random huge insurance bill and going back and forth with the pharmacy for 5 days because you can't get your meds. And it's just such a hard system to deal with. So when you need help, it's hard to go to them for help because it's not really made for you, in my opinion. At least not for me. Many women with autism were late diagnosed, and that can be really harmful to our ability to just exist in the world. Early intervention can greatly improve our developmental outcomes and adaptive abilities. Identifying autism also allows for tailored interventions that address the different social communication, language development, and behavioral changes that kid might have. Additionally, early diagnosis helps families access the right supports, the educational resources, and community programs that we did not have. And that can help ease the parental stress, enhance coping mechanisms, and just boost that person's overall independence. It's a much better quality of life to make these plans and learn these skills in a supportive environment as a child, kind of learn that from the beginning, than trying to go back and fix it as an adult. I feel like I'm playing catch up, at least in my experience. I do want to shout out online communities like r/disability or r/autism on Reddit, as well as different autistic creators have really helped me come to terms with my own experience and feel less alone in a very unforgiving world at times. Now, please put any good resources or safe spaces for people that are struggling with different disabilities or medical issues in the comments below. I would love to see if there are other places that you guys go online to find communities or in person. I know it's a rough system, but hopefully we can all help each other out. As a woman and a non-binary individual, I don't feel safe in our current medical system in the US. It needs to change to serve women and generally everyone better, to be more helpful and effective, especially to women of color. Starting with them legalizing abortion federally, them making women mandatory in medical research by the FDA, making people of color and the queer community important aspects of research and development. We need to advocate for more inclusive and gender-sensitive medical research and testing, which also would include non-binary and transgender individuals who are also discriminated against by the medical system, especially as they're left out of a lot of this research as well. It is so important to share this information with others, to learn more about these issues, and to support efforts to address gender bias in healthcare. Please share this video to anyone you know that could benefit from this conversation, and put any resources that you find helpful in the comments below. I've also provided some resources for viewers to learn about gender bias in medicine, healthy tampon alternatives, abortion, autism spectrum disorder, and racial healthcare disparities in the descriptions below. That's it for today. Thanks for watching. I really appreciate it. Please like the video if you like it, subscribe if you would like to see more, and comment all of your opinions below. Remember to keep laughing through the apocalypse.